introduce Dr. R.C. Sathish Kumar, Research Professor and Coordinator at the Interdisciplinary Institute of Indian System of Medicine, SRM Institute of Science and Technology, Chennai. Dr. Sathish Kumar is a renowned scholar and administrator, serving as the Dean of Interdisciplinary Institute of Indian System of Medicine and Head of Drug Testing Laboratory and SRM Institute of Science and Technology. His vast experiences span across National Accreditation Board for Hospitals and Aviation New Delhi, National Assessment and Accreditation Council NASC Bangalore, and Personal Certification Body Quality Council of India New Delhi, where he served as an assessor and evaluator. He is also a member of University Research Council and Board of Studies at SRM. SRM Institute of Science and Technology. He is one of the Chief Physician and Chairman of Vishaja Ayurveda Specialty Hospital, Chennai. As an expert in Rasa Shastra, Ayurvedic pharmaceutics, and wide experience of 15 years, he has conceptualized and developed evidence-based research products for treating chronic conditions like pancreatitis, diabetes, anemia, migraine, renal calculus, and bronchial asthma. He is instrumental in bringing funded clinical trial projects to ISM, SRM Institute for Science and Technology from DSC, Government of India, Ayush Drug Company, Bangalore, Apex Drug Laboratories Private Limited, Chennai, etc. Currently, he is working as one of the pioneer projects in the pioneer projects of CCRF and ICMR on osteoarthritis and SRM Institute of Science and Technology to launch an herbal anti-drug in public domain. His pioneering work in clinical research, herbal formulations, and pharmacogenomics has earned national and international recognition. With this huge introduction, may I request Dr. R. Sathish Kumar to deliver the topic on exploring the integration of Ayush system of medicine with primary health care. So, ladies and gentlemen, please give a big round of applause for sir.
So I want to know how many of you really need the integration, like who supports the integration of Ayush systems with the conventional system of medicine or allopathy system. Please raise your hand. Students like who want to really integrate. The integration will take Ayush system to the next level. How many of you feel that there are some advantages in integration of Ayush system with otherwise, there are some reservations available with some of the old physicians that we should not spoil the fundamentals of our age-old principles kind of thing. So, any reservations, please let me know and give justification for the same. So, no one have any reservations against integration? Sure, everyone want to integrate. Then why you want to integrate? So this should be an interactive session. So my style of thing is I will not talk from here. I want to the persons to reflect from other side also. The last row, that last row red dupatta. Please stand up now. Please stand up. So integration. What is the word integration? Why you need to integrate? So you have been this is second lecture, I think so, second term. Little bit louder. Unite all the systems. So within Ayush or outside Ayush? Within Ayush. Within Ayush, why you want to unite? If so, what will be the outcome? So please sit down. You are partially right. So anyhow, the integration or integrative medicines defines that like incorporating the Ayush system alongside of the conventional medicines for what? To give better options or lot of options to the benefiters. Who are the benefiters here? patients. Especially are giving this benefits to the patients or outcomes to the patients by the means of preventive and curative aspects. This is the meaning for integration. So students should know that from the day one of academic level where integration mindset should be incorporated to the students. So why we want to integrate? The government of India has recognized the potential role of Ayurveda in One Health issues. You know One Health policies? Do not know One Health policy. Please read those things. What are the updates happening around you? So from 2014 onwards, separate ministry was formed for Ayush. There are a lot of like upstream activities to develop the Ayush system and integration with the other system of medicines have been happening, and these particularly Ayush systems have been globalized. There are a lot of measures have been taken to globalize Ayurveda, Siddha, Unani kind of medicines. So National Health Policy 2017 also says that promoting healthy living beings and prevention strategies from Ayush department is considered for National Health Policy, and whereas they were recommending that yoga pathways in schools and communities were advised, and these have been practiced in some of the government organizations. Till date, when we are looking to the government organizations or government offices in Delhi, we are able to see that yoga break. Understand? So that has given a lot of productivity in their work. So they are literally encouraging, and yoga days, I know in International Yoga Day have been grandly celebrated every year. You all know that one. And recently a survey was conducted around 88% of the WHO member states where those like populations are using traditional medicine in one or other way, either it is of Chinese TCM or of Korean medicine or Japanese medicine kind of thing. Along with our Ayush also been used widely around the globe. And in India, a survey was taken, around 65% of the population, Indian population are using like Ayush medicine as a primary healthcare needs. This was mostly used in rural area where they do not have good access to the medical care. So 1 multiplied by 1 is 1. So if you go against anything, you will not get any benefits. You have to think in a way that you should combine with someone. So 1 plus 1 is 2. When you get maximum benefit, you have to add. So we are better to add any system of medicine rather than go against them or criticizing them, and we are saying we are superior in this way. Any system of science or any medicine have their own advantage as well as disadvantage. We should take the advantage and we should add with them and we should grow. So in such case, holistic approach where the other conventional medicine may have reductionist approach, symptomatic treatment, localized treatment where it will be there, where the Ayush system is considered to be holistic and somewhat systemic approach will be there. And apart from that, in other system of medicines, they have complementary roles where they have their own advantages in the superior dimensions where in radiological images, diagnostic purpose, etc., where we have to complement them and we have to go with them, we have to take help of them, etc. We have strong in philosophical foundations, not like we are rest assured that we are strong in philosophical foundation. At the same time, their advancement, the conventional medicine advancement has multiplied in a huge way in multiple extents. So we should admire them, and whatever the advantages, updates or advancements happening day-to-day basis, we should update ourselves and we should acquire the knowledge also. So this is unified philosophy, whether it is of Ayurveda or yoga or else it is of Siddha and the Unani medicine. Whatever they say is prevention over cure. We target prevention over cure, and wellness is our strength. Wellness treatment or wellness approach is our strength. Whatever like Ayurveda says, Sabdadhatu or Pradoshas kind of thing, whereas Siddha is also saying the same thing. The approach of Ayurveda and Siddha is saying only language different, whereas in Unani, like Anete, Unani, Unani, there are 7 basic components. They also almost go similar with the Ayurveda and Siddha, where the treatment principles differ, and we all like 4 system of medicines. basically concentrating on personalized medicine. This personalized medicine is very new to the other conventional medicine. In 2004, I also Dr. Leora Good, who was the person who coined this P4 medicine. He was stressing more importance to P4 medicine for future. In another 15 to 20 years of time, this P4 medicine will be the medicine of top notch, because he's saying that, like, anybody knows what is P4 medicine? It is almost like correlating with our principles. We talks about Prakriti, we talks about constitution, we talks about personalized medicine, we talks about predictive medicine. Nothing but these are P4 medicines. Once we say, like any white people, we say we never say lies. We believe that we never say lies. But these concepts are being described in our classical text of Ayurveda and Unani is in the 5,000, 6,000 years back. But we are ignoring that one. Now recently the Ministry of Health has taken a very good measure to read that Deshka Prakriti, and they were stressing all the colleges, teaching academic institutions to take the constitutional measurements kind of thing. Really, that is a wonderful step taken forward by Ministry of Ayush, which will give a clear idea about what are the diseases you may get, like what are the constitutional, if you are what are predominant constitutions, what are the diseases you are prone to get. Like that, what we feel for all the system of medicine, the constitution should be taken, and then we can come to the conclusion that so and so people diseases may be getting, the incidence of disease may getting raised in future. So based on that, we can plan the health budget also. Based on that, we can open a lot of wellness centers, and based on that, prevention measures can be taken. So P4 medicine is nothing but preventive. One P stands for preventive, the other P is predictive. Predictive medicine, predictive means what you are going to do. We are going to predict with the help of genomic studies or molecular mechanism kind of things. You are going to predict. And the other P is participatory, and the fourth P is personalized medicine. So this was the word coined by Dr. Wood in 2004. He belongs to Institute of System Biology in California, Seattle. And this fellow has coined this word, and this has implemented in all over the world. Nowadays, this P4 medicine is getting geared up, and in India, maybe in another 10 to 15 years, it will be in public domain. So what we feel, in unified philosophy, we say that we have minimum side effect. We cannot say no side effect at all. We should say minimum side effect. So global popularity. Why we need integration? This is the right juncture for integrations, because the rise of this global popularity for Ayush system of medicines have been in multiple times, particularly after COVID. The business, the market, the exponential growth of the market of this Ayush business have been raised multiple times, and this regional adaptations, even like European EU and the regulatory authorities have accepted some of the plant-based medicines or Ayurveda medicine, Unani medicines. Recently, we have a discussion with the National Institute of Neurology from Germany. They were ready to conduct extensive research on Tataplay, that's Central Asia, what we call as Valari. So they were trying that particular medicine for arthrofibrosis. We never thought of arthrofibrosis. Protocola means what we do, it enhances the cognitive impairment kind of things, or it enhances the memory power kind of thing. But they were using this particular plant for arthrofibrosis, where they do not have a proper line of treatment for arthrofibrosis, where they do not manage the pain and other symptoms of arthrofibrosis. So in China, Japan, in China, the TCM has been flourishing very well. We have very minimal role, where yoga have been adapted very well by the Chinese people and Japanese people. And the United States, even though it is not properly recognized, but a lot of plant-based medicines have been used as nutritional supplements or health supplements. In the individual plants have been used, and the rise of that particular market has been multiplied. And you know, after Boris Johnson has taken the presidency for Prime Ministership of UK, he has recognized our Ayush system of medicine in National Health Survey, and this was bill was passed by the UK Parliament also. So, what are the top 10 common diseases or factors where our medicines are used. Like commonly used camp medicines. Camp is complementary to alternative medicines. We come under, outside India, we come under camp. So 70, you can see like 17.7%, this natural products comes under Ayush, and you can see 6.1%, it comes under Ayush, and then homeopathic medicine 1. Almost 33% of the population's medicines were used were Ayush, one or other Ayush medicines around the world. So a survey were revealed that almost 38% of the adults were using one or other complementary alternative medicines. What are complementary alternative medicines? You can see in this slide. Almost Ayurveda, Unani. Apart from that, they have this massage technique, deep tissue techniques, reflexology, acupuncture, chiropractic. All these comes under camp medicines. So their survey revealed that more women were fond of taking camp therapy than the men, and people with higher literary rate, people with higher rate of education were taking this medicine, and those hospitalized in the past year for one or other day or their post surveillance rate have been increased because of this, and former smokers are using. This was a questionnaire taken, like they have analyzed with the help of 2,400 samples, and they were giving this data. And people with back, neck, and so like mainly of musculoskeletal disorders are using these CAM therapies, and those who are with the GI, gastrointestinal tract disorders and sleeping problems. So this shows clearly what are the percent, like for what diseases people are using the one or other CAM therapies. Mostly almost 20 to 45% were used for some kind of pain management, arthritis kind of thing, or musculoskeletal kind of things. Rarely they are using for some of the chronic disorders or immunosuppressive disorders or immunodeficiency disorders, so on. So you can see almost for back pain, the CAM therapies have been used widely, 17.1%. And apart from that, arthritis, which also comes under orthopedic and kind of things, musculoskeletal disorders, 1.8, neck pain, 5.8%. Around the globe, we are using this therapy. So, what are the key points? So, key point is that to integrate Ayush systems. First, the national policy. We are the government is very clear in promoting Ayush with the help of NAM, National Ayush Mission. Previously, NRHM was there, and even a lot of councils have been established. Like in after 1970, like 1940, the Ayurveda was incorporated as the main in the main stream of education. After that, in 1970, several councils were started. First, CCR. Yes, was started, which includes all the ASU councils. And apart from that, the main key point for integration is the co-location of the facility. Even though a lot of co-located facilities there, for example, in all government dispensaries all over the India, in almost 30 to 40% of the PHCs and the CHC community health center, we have the presence, Ayush system have the presence, but it has not reached to 80%. This is 2014 data. The recent data also not reached 80%. Almost once we reach 80 to 90% of the co-located facility, then the people will have greater options to select their choice of the treatment. So this shows that in district hospitals, 44.3% where our presence is there, and in community health centers, 36.3%. In primary health care, 34.6%. So mostly in urban areas, you can see our presence. The rural extension is not seen much, where government has to take initiation for showing our presence in the rural extensions also. The third important point is training of healthcare professionals. So there is no accreditations or licensing authority as of now for integrative system or integrative medicines. We are separately trained. There should be a common course program should be developed by Ministry of Values or Ministry of Family and Welfare, like where the really interested persons who want to practice integrative medicines can go and learn some common curriculum which will be helpful for integrations and kind of things, where there should be some proposal from both the ministries which will help to practice integrated system of medicine and focus on preventive healthcare, since we are strong in preventive and prevention and wellness area. So our focus should be mainly on preventive healthcare. So research-based evidence, this is the lagging area. We do not have that much sufficient data, kind of like allopathic medicines, where like research input is more. Still, we are in the when we look into the past 2 decades, the substantial research inputs are there, even though we are not matching up to the conventional system of medicine. There are a lot of reasons for that one, where the funding is also different, and our councils are taking maximum measures to give a lot of research-based data, scientific evidence to public domain. So, like the beginning of the slide, I was saying about the advantages or benefits of integrations. The first benefit will be a holistic approach. Like all these people kind of medicines or personalized medicines kind will be integrated. So it will give a preventive and curative aspect and wellness aspect too. And improve accessibility, the patients will have choice. And even the students will have the choice to go for better options, to learn about both the system of medicines as well. In the cost-effective treatment options, this is really a disadvantage for us, where the cost effectiveness cannot be like a strong advantage for our system of medicines, where government should give some subsidy kind of things. If it is of co-located with the government hospitals, it will be a great advantage because the medicines will go freely. And the benefit, the patient will have a wide range of choices for the treatment options. The challenges are we do not have a standardized practice. For example, if for cough, I prescribe Talisalichurna. Other practitioners will prescribe Sithophilalichurna. We do not have standardized treatment of care, and their approach of pulse diagnosis or in the Ashtamila Pariksa or eightfold diagnosis and so on differs. They are the own practices. It is very difficult to standardize, but coming into the common platform, we have to standardize. Unless we standardize our treatment pattern, it is very difficult to go for any integrations kind of thing. So each, even we have cultural biases. So if we go outside the India for treatment, where we have a lot of cultural biases and we do not get enough raw materials or drug over there, so there becomes a difficulty to practice. And in such cases, the government should come forward, even though in WHO ICD codes are happening, but standardized SOPs for treatment and standardized SOPs for prescriptions should be there, and there may be a lot of choices to choose the drugs, but it should be standardized. On what conditions these kind of drugs can be given. For example, we are discussing with the ICMR director, deputy director, if you are prescribing paracetamol, they know on what are the conditions paracetamol can be prescribed. For diclofenac, they know very well because they have the PKPD data with them and they know their adverse effects or side effects and so on. But we people are lacking of that one. And as I told, there are a lot of variations in the prescription mechanism itself. The style of prescriptions or the pen practice differs from area to area and based on the institutions to institution. So this can be standardized. The government should take a maximum effort to standardize this one, and that scientific gap. And this scientific gap can be fulfilled with the front runners who are in the government policies. Like separate budget should be there, a lot of research, evidence, and so on. And training and awareness, I said there should be a policy or accreditation body should be formed, licensing authority should be formed to accredit this type of integrative medicine kind of thing, where a lot of students will come forward for getting the course, like bridge course kind of thing, where students will be really interested to learn so this kind of integrative medicine and practice. So that's I was keep on saying about the regulatory challenge. This will be the greatest obstacles. Once this regulatory challenge is clear, only there will be hassle-free integration will be happening. So that will be the greatest challenge. The council should take measures to form the regulatory bodies for the same, and the cost, cost will be always an prime factor for any Ayush doctors. I hope so in the private practice. Without 2 to 3,000 rupees, we cannot prescribe medicines for 1 month also. So in such cases, government should take measures to bring some subsidized costs or tax cut kind of things to practice very well, so that integrations will be more in private part also. As of now, the government part integration is quite working, but in the private integrative practice is not happening. Only few hospitals we can name for private integrations. So if you want the private integrations, the Ayush integration with the allopathic hospital, then the cost matters a lot. So in what are the avenues or areas where the really integrations can happen? The first one is the surgery, pre-operative, perioperative. Perioperative means of the preoperative, the intraoperative, the post-operative, where the Ayush doctors can play is pre-operative and post-operative. For example, in antenatal, postnatal care. In the antenatal care, really the Unani or Ayurveda doctors or Siddha doctors have a great role to play for making them for normal delivery kind of thing. Instead, forcing them for C-section scores kind of things. And in case of any surgery, like apart from C-section score, like any surgery of appendicitis kind of appendectomy kind of thing, where the healing, ulcer healing or wound healing, really this external applications of our Ayush system medicines will be helping. And in the pre-operative procedure, the anxiety and other thing will be there. We can console with them with some of the anxiolytic oil, like herbal anxiolytic medicines kind of thing. So the second one is integrating our Ayush practitioners in case of nanorectal disorders. That will be of great integrations where the Charasutra therapy or Karanal therapy has been essentially told in Ayurveda and Siddha, which can be really integrated with the allopathic system of medicines in case of fistula or in case of hemorrhoids, especially nano, where really the proven results are desired results are there. In such case, we can integrate with, we can take help of anesthetists, and Ayurveda surgeons can play a vital role in that one. So cancer care, really there are a lot of integrations, but it has not been documented. Like we people are helping a lot of cancer patients with their to improve their quality of life and to improve their immunity to subside the pain. Whereas the cannabis, no, the cannabis THC and CBD have been widely used. The usage of cannabis, CBD and THC. Anyone knows what is CBD and THC? CBD, cannabinoids, and THC. You are not aware of that one. So these two compounds have been widely used till date. This is the emerging drug for pain management, especially in cancer. So this has been legalized for medicinal purpose in European country. In another 2-3 years of time, it will be legalized in India also. This particularly this CBD has a wide application in pain management of osteoarthritis, and it has real capacity to control the metastasis of cancer too. There are extensive research, huge investment of money has been done by the private companies. Even the big pharma players have been investing hugely, like Sun Pharma also to name few, have been hugely investing on this cannabis related research for variety of management. This has been used for reducing the size of fibroid also. Like Fuji Chemicals from Japan, they are conducting one trial on osteoarthritis with the help of cannabis. And immune system support, you know that for COVID-19 we are giving lot of kashayas and making them ulcerative patients. We do not prescribe the correct dosage for any kashaya. One will prescribe 60 ml twice, one will prescribe 60 ml once. There are no fixed dose formulations available, so that should be regulated. Where we are actually lagging behind. And nanomedicine, this was first told in Basmas. Basma is nothing but the nanomedicines. It was documented in our ancient manuscripts. So this nanomedicine in other form is known as quantum dots. When you incorporate this quantum dots with the nano medicine, this will give good results in case of cancer. Because smaller the medicines, greater the absorption. Smaller the so in that concept, this is playing a vital role. Nowadays, the green synthesis and nano medicines and quantum dot therapies have been geared up because of their greater absorption in case of cancer. And extending the survival of cancer patients, which can be done with the help of Ayush medicines. And you know, there are a lot of immune enhancing strategies like Guruji or Dinospora cardifolia has been recognized as the national medicinal plant of India, like a couple of years back. That is a wonderful medicine for enhancing the immunity. For that purpose, there is only medicine called as Amrit, nectar, no other medicine. Because of that property only, it has been recognized as a national medicine plant, and that is the one plant which can be used to enhance the immunity. The pre and post chemotherapy already we are using, but there is no proper documentation. Really, we are very poor in documentation, so that we are not able to compete with the public domain, scientific domain as well. Where in the pre-operative treatment also, we have a lot of medicines for the cancers. As like up to stage 2, you can handle alone. Depends upon the area of the cancer. For ovarian cancer, there are a lot of medicines available, and we can bring down all the inflammatory markers or like ovarian cancer markers, CA125 and so on. They are like we have the proven results. There are a lot of papers published in the scientific domain, and there are a lot of papers published in the Scopus industry journals as well as Elsevier industry journals. So in psychiatric treatment, analysis was done. It was showing wonderful results in mild to moderate depressive conditions. Even homeopathic medicines have been there. It is not well documented. Few studies are available. It is showing a good result, disabled result in mild to moderate depressive states. And the next one is GAD, general anxiety disorder. Even in SRM for Brazil regulatory compliance, we have conducted trial. Like Himalaya drug company has sponsored the trial. Like Ashwagandha 500 mg tablets, its extract form was used, and we are able to see the balance of the serotonin and melatonin pigment, and there were wonderful results. So really, our medicines are helping a lot in such conditions. And apart from that, where ASDs, artisans kind of thing, also there is no proper treatment or internal drug available. So where really this Ayush system can be a niche area where we can work on it. So we have medicine from childhood to geriatric conditions, old age. So where the national programs or incorporation of this particular Ayush medicines can be done from Swarna Prashna, we can make it out. Swarna Bindu Prashnas, like we can make, like instead of giving a lot of vaccines, the real or the vaccines which is mandate can be given. Apart from that, vaccinating for so and so virus and other things can be avoided, where Swarna Prashna can be advised with the help of integrative medicines. And it's for homeopathic, in the healing or boning conditions, we give this calcaria. And Unani for patients, this Safui Musafi, which enhances the immunity and digestion, which can be like given in the toddler's period itself, where we get good results. Like we can have these children or toddlers or teenagers will be applying towards the respiratory infections. So geriatric conditions, we have a lot of medicines. We all know that where really like Ashwagandha or Chawanprash, all those conditions to improve the balance strength of the persons will be helping a lot. So for apart from this area of integrations, the commonest integration is musculoskeletal disorder. There are a lot of center for musculoskeletal disorder. Really, this kind of like integrations, like where Basti or Abhyanga or the massage therapy from Unani medicines or Siddha medicines are really helping any like paraplegia and hemiplegia cases. And apart from that, in most of the conditions, osteoarthritic conditions, where more like many patients visit Ayush OPD. So in such conditions, we can really integrate and we can work on it. So skin conditions, there are a lot of skin conditions where we do not know idiopathic causes. We can integrate really with in case of vitiligo, where there is no proper protocol. Like Ayush practitioners can be involved in this developing a protocol, common protocol for treating, like UV light therapy you can keep aside, and like along with that we can have internal medicines of Ayush. So the most important point is like you practice a spatial question. Like whenever a patient comes to you, I am taking anti-diabetic medicines, metformin, vildagliptin, sitagliptin. So whether I can take your medicines for those conditions. I am taking warfarin, cosprin, 75 mg. So what will be your answer? Internees, any internees here? No internees. What will be your answer? So your students will be prescribing your family members, your grandfather or grandma. They will be having one or other any comorbidities, any disorders. You will be giving your medicines. Whether it is right to co-administer your medications with the present medications, the conventional medicine. Any answer? We do not have answer for this. Whether it is right or not, we do not know. It is running as far as there is no problem, no questions, we are safe. If there is any objections comes, then there is lot of like difficulties in front of us. So there is some study known as drug-herb interaction studies, which will really give you a clear picture at what drug you can co-administer and give. For example, I request, that's what this is my request to Dr. Sathish sir, where he can propose a national center for drug-herb interaction study. This will be a wonderful contribution to the public domain as well. Because we are prescribing Google for any management, pain management. If a person is taking ecosprin or aspirin blood thinner, the further blood thinning activity will be there. The blood thinning activity will be increased. So better to avoid Google with blood thinners. Likewise, if you are having prescribing any turmeric associated or included formulations, it will not work in anti-diabetic formulations. There are proven results. And for example, if you are using warfarin kind of thing, and you are using St. John's wort or Brahmi or Gotukola centralization.